Hi, myself Dr. Ruchira from Eledent Dental Hospitals. We are located in Kondapur, KPHP, Manikonda, Banjara Hills, and now even at Kompally. Have you ever wondered why you walk into into a dental clinic and the dentist asks you common questions like, where do you work? What do you do? How about your sleep pattern? Are you a vegetarian? Are you a non-vegetarian? And things like that. And most of the time, the patients have that misconception that we dentists ask you or tell you or get to know about you is to charge you accordingly. But no, you're absolutely wrong there. The reason why we have these small talk or the small conversation with you is so that we can plan your dental treatment much better. What happens is when we try to know about you, we try to customize your dental treatment accordingly, because of which you have your own blueprint to maintain your dental health. Yes, you're right. Your customized personal blueprint to maintain your dental health. Supposingly, I get to know that you have a sleeping or a snoring habit. This is a sign of sleeping apnea. What happens here is we correlate it to teeth grinding. When you have to tend to have your teeth which are grinding, we tend to understand that okay, this patient has a certain problem. Then we ask you about your work life. When we ask you about your work life, we try to understand if you work under a lot of stress, where you again tend to grind your teeth, because of which there is wear off of enamel and sudden sensitivity that happens to you. Apart from that, we ask you for your diet and lifestyle. Why we ask you about your diet and your lifestyle is to understand whether you're a vegetarian, whether you're a non-vegetarian, what are your eating habits, what do you eat more, what do you prefer, how do you eat, is because based on that we can decide what type of a filling could work for you or what type of a material to be used for you if we have to introduce a crown in your mouth. So that is why we exactly try to find out all these things. And the most important thing is we ask you about your medical history. Probably you must be wondering, why do they need to know about my medical history? Apart from anybody who's undergone any surgeries or anything, we still tend to ask you, what kind of medication are you taking or what are you doing? The exact reason for this is the minute we understand that you are taking a medication, and if it's a new medication, please remember that it is a green light for rapid tooth decay. Yes, you got me right. It is a green light for rapid tooth decay. So always make sure when you are starting any new medication to make sure everything is fine in your oral cavity, so that you understand that there is no dry mouth that is happening. Once you start to have a dry mouth, that is because of some new medication that you have been taking. So to make sure that it doesn't happen, make sure you keep a look on it and always let your dentist know or your family dentist know that I have started so and so medication. So let us keep a check on it to make sure that I do not have any further decay that is happening. That's all for today. I hope you like this video. Thank you. Bye-bye.